Hi, I'm Susan Taylor with Scripps Health in San Diego, California. Please subscribe to our Scripps Health YouTube channel. We've got great videos featuring the very latest technology, our stellar doctors, and inspiring patient stories. Today, we're going to talk about heartburn. That burning sensation in your chest or throat, that bitter taste in your throat. Do you suffer from heartburn? What triggers it? Let us know in the comment section below. According to the American College of Gastroenterology, some 60 million Americans experience heartburn at least once a month, and about 15 million people have daily flare-ups. How do you control heartburn and indigestion? Here to talk about that and to help you cool the burn is Dr. Richard Onishi. He is a family medicine physician with Scripps Clinic in Carmel Valley, California. Thanks so much for being with us, doctor.
Oh, thanks for having me.
So let's start off with the basics. What is heartburn?
So heartburn is when you have an upper abdominal burning that goes into the esophagus and burns the esophagus and sometimes the back of the throat.
So what is it that's burning up? Is it stomach acid?
Yes, your stomach is actually an acidic environment and it's protected by a layer of mucus. You have mucus secreting cells in the stomach. Unfortunately, the esophagus doesn't have that same protection. So if the acid refluxes through up into the esophagus, it causes a burning pain.
So what triggers it?
There are a variety of triggers. First, let's talk about dietary triggers. So acidic foods, spicy food, fatty foods, fried foods, caffeinated drinks, carbonated beverages. Cigarette smoking can make it worse. Alcohol relaxes the lower esophageal sphincter and can make reflux worse. Anatomic things, for example, if you eat a large meal, it distends the stomach, and especially then if you lay down, reflux happens more commonly than at night. Other things would be obesity, even pregnancy, certain medications, aspirin, non-steroidal anti-inflammatories, ibuprofen, Motrin, Advil, Aleve, different medications used to treat osteoporosis, Fosamax, Actonel, other bisphosphonates, chemotherapeutic drugs. So there are a variety of exacerbating factors.
Go back for 1 second and talk about acidic foods, such as what? I mean, when I think of acidic or something spicy, I think, okay, of salsa, but what other foods are acidic?
Well, citrus, tomatoes, tomato-based foods or sauces. Of course, your spicy foods also, you know, your jalapenos and salsa are good examples.
But what about when you say citrus, what kind of fruits are you talking about?
So oranges, lemons, that family of fruit.
And what are the symptoms that you're having heartburn?
So the classic symptoms would be that epigastric, the upper abdominal burning that radiates up. People often complain of regurgitation. So when you get some stomach contents into the mouth, and often patients may even vomit small amounts of undigested food. Other symptoms are hypersalivation, meaning they produce more saliva, a globus sensation, which is a feeling that something's in your throat.
And you can't really swallow it down.
Right. So it feels like patients complain of a foreign body in there. It feels like there's something in my throat. There's also painful swallowing, difficulty swallowing. They can have extra esophageal symptoms, so symptoms outside of the gastrointestinal tract, such as a cough, a chronic cough, or it could even trigger asthma.
Who is susceptible to heartburn?
You know, like you alluded to earlier, everyone. I mean,
oh, there you go, everyone.
Right. You know, everyone's susceptible, and but you certainly have risk factors that predispose and increase your risk. So the obesity that I mentioned earlier, and it just causes some compression, increases the pressure there. Same thing, you know, pregnancy, you know, is another issue. The cigarette smoking, the medications, the alcohol. Also, there's anatomic reasons. So people can have a hiatal hernia, which is fairly common. So a hiatal hernia is you have your esophagus, and then you have your diaphragm, and then underneath that is your stomach. You actually have a muscle right here called your lower esophageal sphincter that relaxes when you eat food and then contracts so that stomach contents don't reflux back up. So your diaphragm helps pinch that lower esophageal sphincter. And what happens with the hiatal hernia is the stomach actually leaks up into the chest cavity, and so you don't have that tone there, and so reflux happens more easily.
Let's go back and talk about pregnant women, because more than half report symptoms in the second and third trimester. Why is that?
Well, two main reasons. One is just anatomic. So as they advance in pregnancy, the uterus enlarges, the abdomen distends, and that puts pressure on the stomach, and then again, reflux happens more easily. The other is actually hormonal. Progesterone actually relaxes the lower esophageal sphincter. So as they move on in pregnancy, progesterone rises, and that contributes to reflux.
So does this go away after you give birth?
Fortunately, with delivery, the heartburn typically resolves.
And how do you know that burning in your chest is heartburn and not something more serious such as a heart attack?
That's a very important differentiation to make, and sometimes it's not as easy as it sounds. You know, classically, cardiac chest pain is a diffuse, squeezing pressure pain, often accompanied by shortness of breath, nausea, vomiting, sometimes lightheadedness, and patients will complain of getting sweaty. It's often related to exertion as well. So classic history was, hey, I walk up a couple flight of stairs, and then boom, I get this diffuse chest pain along with those other symptoms. You know, heartburn tends to be more focal, so not diffuse, you know, fairly localized. The nature of the pain is different. It's a burning pain, and again, typically has those exacerbating factors. You know, alcohol makes it worse, large meals make it worse, and then certain treatments make it feel better. You know, antacids, Tums, Prilosec, you know, those types of medications that we may talk about. But it's in two types of patients. You have to be very careful. Like women often present differently from a cardiac standpoint, and so do diabetics. So I've had one patient come in and say, hey doc, I'm having heartburn, but his symptoms were pretty classic. It was a localized burning pain, but it wasn't better with the normal treatments, and it was worse with exertion, and he was a diabetic. And so I did an EKG, which was fine, but then proceeded with a stress test, and he had cardiac disease, and then got stented, so his heart arteries got open. They put a stent in.
To open up.
Yep, to keep him open, and he did fine. His what he thought was reflux resolved. And
what is GERD?
So GERD is, well, think of heartburn as the symptom, and GERD is the disease or the condition. So GERD stands for gastroesophageal reflux disease, and so basically people with GERD it's defined as heartburn symptoms that occur if they're a mild degree twice a week or more severe weekly, or patients have complications from their GERD, which could be ulcers, strictures, chronic reflux can even cause two different types of cancers, adenocarcinoma of the esophagus and lymphoma.
So how do you treat GERD?
Well, the first thing I would recommend is try to eliminate the triggers. So if alcohol is the trigger, if cigarette smoking is the trigger, if spicy foods is the trigger, is to eliminate those triggers. Other things to do is weight loss has proven to be helpful. Elevating the height of somebody's bed is helpful, so 6 to 8 inches, and so they can put blocks under the top of their beds, or they have wedges that elevate the bed. Try to avoid eating 3 hours, well, eat at least 3 hours or more prior to bedtime. You eat right before bedtime, and then you lay down, you know, your stomach gets distended, and then reflux is more likely. And then, of course, there are a variety of medications.
And eating slowly?
Yes, eating slowly may help too, yes.
And what about, rather than 3 big meals a day, what about more frequent, smaller meals throughout the day?
Yes, that is an excellent idea. And kind of the same premise is that if you over-descend the stomach, you're more likely to get reflux. And if you eat small, frequent meals, you're not distending the stomach as much, and the pressure's lower.
And what about chewing gum?
You know, maybe I'm not a big fan of gum chewing to alleviate reflux. I know it's listed as being of benefit, but patients can certainly try it, but I haven't found it to make a whole lot of difference.
And what about drinking water at room temperature? Does that help with digestion?
Again, if you look at the studies, I don't think there's good clinical evidence that it helps with reflux symptoms. So it's one of those things where some people may feel it's beneficial, and certainly they can use it. There's no harm in it, because in other patients, unless cold water or cold fluids is a trigger, then drinking warm water I don't think would be helpful. But if it is a trigger, then doing that is a good idea.
So in a couple of minutes, we're going to come back and talk about this. We want you to hold this thought. When should you say, okay, I've really tried all this on my own, and I really need to go see a doctor to treat this condition? We'll come back and talk about that in just a couple of minutes. You mentioned certain types of medications. Let's go through them, the list to treat heartburn. Let's start first with over-the-counter and then go to the prescription medications.
Okay. And that's a good point, because now the line is a little bit blurred. A lot of the medications that used to be prescription are fairly safe and are now over the counter. But the most commonly used ones have been out there forever are your antacids. So things like Tums and Mylanta, they just neutralize the stomach acid. The next step up would be H2 blockers, which are Pepcid, Zantac, which is famotidine and ranitidine, and those bind to cells in the stomach, parietal cells that produce acid, and reduce acid production that way. And then the strongest medication would be proton pump inhibitors, and so those are things like Prilosec, Nexium, Capodex, Protonix. There's a variety of them, and they're the strongest medications to reduce acid. Well, there's another class of medication, Carafate is a common one that helps coat the stomach. So those are the mainstays of medical treatment.
So how often should you take this medication, and how long should you take it?
Good question, because that now is a little more controversial. In years past, we thought proton pump inhibitors were really benign and patients can use them long term. We still use them long term in certain high-risk patients, but we don't like to use them long term if we can get away with it because of potential side effects.
And the side effects are?
Side effects, well, there's a list of side effects. One thing that Prilosec or PPIs as a class can do is increase a patient's risk for osteoporosis. So it does that by two main mechanisms: reducing the absorption of insoluble calcium, which is soluble calcium dissolves in water. And so soluble calcium, it really does not affect the absorption of. So milk, dairy products, patients can still absorb the calcium from those well. It's kind of calcium carbonate, which is a common supplement. It will block the absorption of. Calcium citrate is a soluble form of calcium, and patients can absorb that fine on a proton pump inhibitor. The other mechanism, how it causes osteoporosis, is it affects osteoclasts. For bone remodeling, there's two types of cells: osteoblast, which cause bone deposition, and osteoclasts, which take bone away. So proton pump inhibitors seem to augment osteoclast activity and cause a net reduction or bone loss and increase the patient's risk of osteoporosis. It can also lower magnesium levels, which is equally, if not more important. Magnesium is involved with muscle contraction and heart rhythms, and so if somebody's on a proton pump inhibitor chronically, I would recommend they get that screened periodically, especially if they're at risk for arrhythmia. They may increase someone's risk of pneumonia, Clostridium difficile, which is a type of colon infection, but these risks are fairly low. So, I don't want people to be turned away from these medications if they need them, but they should be aware of some risks.
How do you deal with heartburn during pregnancy without taking medication?
So first would be avoiding the triggers. Okay. Secondly, we wouldn't want them to lose weight. Hopefully, they're not smoking or drinking. So
no spicy foods. Keep it bland.
That's right. That's right. So watch the caffeine. Watch the carbonated beverages, acidic foods. The citrusy foods. Those types of things. The other thing that really can be helpful is, again, the elevating the height of the bed. It sounds like a simple thing, but in a recent meta-analysis of 16 different studies, the two things that really proved to be effective was weight loss, which obviously is not appropriate in this patient population, and elevating the height of the bed.
So you want your head higher than the rest of your body.
That's right.
What about sleeping on your side?
So laying on their left side may be of some benefit. Anatomically speaking, the esophagus goes here, and your liver's on the right side. Your stomach is more on the left side. So if you think of, if you lay on your right side, could this reflux more easily? So potentially laying on your left side can be helpful.
And let's talk about indigestion. Does it go hand in hand with heartburn?
Yes, indigestion is more of a layman's term, not so much of a medical term, but it's used to describe an upper abdominal pain often associated with food. So think of that is a symptom. So obviously heartburn, reflux would fall under that category, but other things can cause upper abdominal pain with food. Gallstones, food intolerances, lactose intolerances, celiac sprue, which is a gluten insensitivity or wheat allergy. So there's a variety of causes of indigestion. It's not just one entity.
So how do you treat indigestion?
So you treat the cause. So basically, if it's the heartburn, reflux, you treat it, as we talked about earlier. If it is due to gallstones, the treatment there is primarily surgical. There are some medications for gallstones, but they don't work very well, and you have to take them for an extended period of time. So for indigestion, again, think of that as a symptom, and so find a cause and then treat the cause.
All right, so that moves us to the next point, and we referenced this earlier. Let's come back to it. How do you know it's time, really, when you've done all you can, that you really need to go see a doctor to treat this?
So let's say you've tried some of these remedies, you're having ongoing symptoms, and none of these have helped. Certainly you should see a physician. But there's also some earlier danger signs. So if you're a patient over 60 and you haven't had heartburn before and you're having new onset heartburn, you should see your doctor. Other danger signs are painful swallowing, difficulty swallowing, any signs of blood loss. So vomiting blood, vomiting something that looks like coffee grounds, because that's what digested or partially digested blood looks like. Black tarry stools, because black stools is what digested blood looks like. Other things can turn your stool black, like Pepto-Bismol or iron or things like that. So it doesn't mean a stomach bleed, but it could be a stomach bleed. Difficulty swallowing, unexplained weight loss, and if you have a first-degree family member with a gastrointestinal cancer, so meaning parent, sibling, or child, that increases your risk.
Any final thoughts, doctor?
I think if you're ever unsure, especially one of the most important things you brought up was the chest pain. How do you know you're having cardiac chest pain versus reflux? So if you're ever unsure, see your doctor. If you have significant cardiac risk factors, so if you're a diabetic, have very high cholesterol, high blood pressure, family history, a cigarette smoker, I would definitely be more inclined for you to see your doctor sooner rather than later.
Thanks so much, Dr. Onishi, for your time and your expertise.
Oh, you're welcome.
If you want more information on heartburn and indigestion, just click on the link or go to scripps.org/videos. Want more critical information about your health? We take care of you from head to toe. Please subscribe to our Scripps Health YouTube channel and follow us on social media at Scripps Health. I'm Susan Taylor. Thanks so much for joining us. It's our mission at Scripps to help you heal, enhance, even save your life.